Welcome to my presentation. My name is Zoe Rezende, and I'm basically talking about the relationship between physical exercise and how it helps cancer patients. In my first slide, I basically talk about the benefits of physical exercise to prevent cancer. And basically, throughout this presentation, I basically just referenced my citations, and I'm basically just explaining how 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 one should understand it. In the Cancer and Physical article that I read, it basically just says that moderate exercise, like 20 to 30 minutes every other day, helps with the immune system and helps with anti-inflammatory effects, which is very beneficial to the body, especially when it comes to preventing cancer. And in my next slide, I basically talk about what happens to the body during exercise. So during exercise, natural killer cells are increased, as well as the number of leukocytes, lymphocytes, and neutrophils. Leukocytes are basically cells that counteract foreign substances and diseases. Lymphocytes are white blood cells that obviously help the immune system, and then we have neutrophils, which fight infections. This also goes to natural killer cells that help with the circulation of blood after exercise, and basically are a type of lymphocyte which play a big part in host rejection of tumors and infections, which is obviously really important when it comes to cancer prevention or for the development of cancer. And I basically just list other benefits of exercise, which basically improves the immune system, very important, prevents high insulin levels, which is related to pancreatic cancer, reduces certain sex hormones, which are related to breast cancer and colon cancer, and reduces digestion time, which is related to colon cancer. There are other examples, but I just only listed a couple. And in my next slide, I basically just I referenced this picture from the Cancer and Physical article that I read. It's just a simple picture to show how regular moderate exercises helps reduce fat and obesity, which has been known to be a cancer-causing agent, and reduces inflammation, the risk of cancer incidence. It also increases the survival chance of a cancer patient, as well as the natural killer cells and immune system. In my next slide, I basically talked about the benefits of physical exercise during chemotherapy. And during chemotherapy, which is such a harsh treatment, it is very hard on the body, and the cancer patients can't really be that physically active. And during that time, the body can go through muscle atrophy if they're not exercising enough. So brisk walking and static cycling are safe exercises for them to basically do to avoid such a thing from happening. And again, also helps with the treatment as well. They're going through depression, they're going through such a harsh time that when exercising, it releases hormones that elevate their mood. In my next slide, I basically just showed a chart referenced from Cancer and Physical Activity and Exercise, which basically shows that overweight and obesity and physical inactivity are only 2% of the cancer causing agents. And even though 2% might seem like a small thing, there are 1.8 million diagnosed patients with cancer each year. So 2% equates to approximately 135,000 cancer deaths each year, as stated from Cancer and Physical Activity and Exercise. In my last slide, I basically talk about the benefits of physical exercise post-treatment, and basically after such a harsh treatment, the body has a lack of functional capacity, muscular strength, body weight, composition, flexibility, is going through so many changes, not just diarrhea, pain, physical pain, and exercising, especially after the fact, helps with the depression, anxiety, mood, the self-esteem, satisfaction, and overall quality of life of the person after such a treatment, as well as avoids a relapse of the cancer happening again. And on my last slide, I basically just listed my citations. Thank you very much for watching my presentation. So.